So let's kind of recap what we just learned in the previous video, which was about the levels of evidence. We were looking at the levels of evidence, and we were saying if it's high up in the pyramid, if you read a research article that's higher up, it's good. If it's lower down, it's not so good. It's not so credible. So we want to aim for finding articles that are up higher in the pyramid. So here's a question for you. The highest level of evidence for evidence-based decision making is which of the following? It is the meta-analysis and systematic review, because if we look in the pyramid, that's the highest one over here. Observational study would fall under this one, where you're just watching what's happening and you're following people over time. That would be an example of that would be a cohort study. That was one of the options. Case report, and this is further down. A case report is where you have one person with a unique situation, and your doctor, for example, writes about that case and publishes it. That's a case report. We're looking at just one person who has a specific disease. In vitro or test tube research, that you can see is way down there. And again, that's not really good because it's not done on actual humans. It's done on extracted teeth, for example, which is a test tube or in vitro type of research. Not exactly credible. We like it when it's done on real humans, when research is done on real humans, because then we can apply it to our clients. Here's another question. Types of research studies in which the researcher does not give a treatment, intervention, or provide an exposure includes which of the following? So which of the following has ones that do not give a treatment? So do not give an electric toothbrush to people, for example. Do not give an intervention. Do not give an treatment. Intervention is similar. Do not give a group an electric toothbrush. It is A, it is B, and it is D. So all of these, A, B, and D, are ones where the researcher is not giving them a treatment. They're not giving them an electric toothbrush. They're not giving them a pill, for example. They're just finding a group of people who have an electric toothbrush and they're following them over time. They are finding people who have an electric toothbrush and they're going backwards in time. That's case control study. A randomized control trial is when you give them an intervention, when you give them a treatment. So if we go back to our randomized control trial image over here, you are giving them a treatment. You're giving them the electric toothbrush and you're following them over time. Your control group, they're continuing on with their manual toothbrush and you're following them over time. With a cohort or case control, you're not giving them a treatment. You have already the group of people that have the electric toothbrush, or the group of people that are smokers, and you have already the group of people that are not smoking, and you do not you do not give them any treatment. You just find those people that have that condition, or that have that are already smoking, for example. So great places to find articles are PubMed, Cochrane. So you want to find scientific databases. So in your school, you may have access to the library's scientific databases, such as PubMed, Cochrane, Google Scholar, EBSCO, that sort of thing. Now, when you develop a question, let's say you have a research question, let's say your client comes to you and says, I'm not sure about this product, what do you think? And let's say you're not sure. If you're not sure, you're going to do your research on it. And when you do your research, there are the 5 A's that you need to think about. You first have to figure out how you're going to word that question. Then you got to access or acquire that question. Then you got to do your computer search. Then you got to appraise it. So then you got to see whether the paper that you're looking at, is it a good paper? Is it a bad paper? Is it high up in the pyramid or is it low down in the pyramid? Then once you find all the good papers, then you're going to read it and then you're going to apply that knowledge to your clients, and you're going to tell your client, you know what, this product is actually good, why don't you start using it? And then you're going to assess it, and then you're going to follow up with your clients that use that, and you're going to see whether that product actually worked or not. So you're going to evaluate it. So there's a cycle that goes through. So it's the 5 A's. This is, don't get confused with the 5 A's for tobacco cessation, where we look at ask, assist, advise, that kind of thing. This is a different 5 A's. This is the 5 A's used for research. So the first question I have for you is, a well-constructed Pico question includes which of the following 4 parts? It is C. P stands for problem, I for intervention, C for comparison, and O for outcome. Whenever you want to ask a question, the first step when in research is you first come up with a question. And when you come up with a question, you want to come up with a Pico question. Pico is where the P stands for what is the problem, the I stands for what is the intervention, what is the treatment, C stands for what is the comparison, and O is, well, what are we hoping for with that treatment? What is our outcome? And so the way we word our question is like this. For a client with plaque and bleeding, so plaque and bleeding is our problem, well, what is our intervention? A powered toothbrush. We're using a powered toothbrush. That's our intervention. That's our treatment. Compared to a manual toothbrush, always compare it to something. Sometimes, you can have no comparison. You can say C is actually an option. So you could have, for a client with plaque and bleeding, will a powered toothbrush better remove plaque and reduce gingival bleeding? And you skip the C completely, but it's always better to have a C. So yes, you could have no comparison, but try to compare it to something. It just makes it more stronger. And then O stands for outcome. What are we hoping for? Reduction in plaque, or perhaps reduction in bleeding. So O is the outcome. So when you write a Pico question, this is the format it should be in. So step 1 is ask. Step 2 is access or acquire, which means you're doing a computerized search with PubMed. You're finding scholarly journals. You're finding peer-reviewed literature. Peer-reviewed, when you see that word, peer-reviewed means there are people who have reviewed your articles, people who know about the topic, so like people that are educated that have reviewed the paper and have given feedback to the author, to the researcher, and then once the researcher corrects all their feedback, then they publish it. So peer-reviewed is it was looked by other professionals and before it was published. So that's kind of good, right? Because people reviewed it before it was published, and so that lends credibility. So PubMed is a great example of finding articles. Step 3 is appraise. Appraise means now you're figuring out whether the papers that you're looking at, what the research papers that you're looking at, is it really credible? Is it really good? Are the results of the study valid? Validity. Validity means that the researchers, when they wrote that paper, did the conclusion, did what they say, did it make sense? Did the data support their conclusion? And then, what are the results, and do the results help you for your client? So you want to really appraise the evidence. And if that paper is a good paper, you're going to apply it. You're going to use that paper. Key thing here is don't just look at one paper. If one paper has, shows that that product is good, for example, find more papers that support that. Don't just rely on one paper. You want to find at least 5 or 6 papers if possible to show evidence that, the product that you're actually looking at does actually work. Now, when you're looking at papers, one of the things we look at is there a statistical significance? And I have a video that goes over the difference between statistical and clinical significance. So I do encourage you to watch the difference between the two. But what I want you to know for this purpose is that if you look in your research paper, and if you see p-value, P stands for probability. If it is less than 0.05, so if you see 0.04, if you see 0.02, 0.03, for example, anything less than 0.05, it is a good study. There is statistical significance to show that that study worked. So p-value basically says, yeah, you know what? When they did the math shows that that product is a good product. Okay, so if they give you an option, which statistical significance is good, and they give you these options, 0.05, let's say 0.03, and C is 0.08. Which one is the best statistical significance? Which one is a really good one? Which one shows that your study is strong? You want to choose the lowest number. So you want to choose 0.03. If P is less than 0.03, that's really good. The lower the number, the stronger your study. And again, please look at that video to look at the difference between statistical significance versus clinical significance. Clinical significance is when they don't look at the math, when they don't look at, the numbers here. Clinical significance looks at, yes, the product, they might say, yes, the product is good, but the product is very, very costly. And so no client will use that. So therefore, I won't recommend that product because it's extremely costly. Or they might say, you know what, yes, the numbers look good. You know, yes, the number is like p-value is less than 0.05, but I'm not going to recommend that product because it's very, very hard to do. It's very cumbersome to do. And so I don't think the client will do a good job with that product, and it's not going to be as effective because they don't know how to do it effectively. So if that's the case, then it's not clinically significant. Even though the math shows that it's good, if the client's going to struggle using it, then you're not going to recommend that product, right? So clinical significance is they look at it clinically now. Is it worth recommending it to their client? And again, that video that I'm recommending you to watch goes over the difference in detail between the two types of significance, statistical versus clinical. Finally, step 4 is apply the results. So you found the great papers, you have found like maybe 5 or 6 or if not more papers about that product. So now you're going to recommend that product to your clients, and you're going to get your client to use that product, or you would use that product on them. And then you would evaluate it. Last one is evaluate. Did that product work in all your clients? Did it work in some of your clients? What went well? What didn't go well? And you'll figure that out. You'll evaluate the product, and then based on your evaluation, you can then realize or then figure out whether you would recommend it again to your other clients or you would not recommend it. The last thing I want to go over is sampling methods. And so key things to keep in mind here is that whenever a researcher is doing a study, they're usually interested in the population. So for example, if I'm a researcher and I want to learn about how you studied for your board exam, let's just say. And let's say there are 5,000 people that are writing their board exam next month. So if 5,000 people are writing their board exam, and I want to know how all 5,000 people studied for their board exam, it's impossible for me to reach out to all 5,000 of you. Like, that's impossible. So instead, what I would do is perhaps I could reach out to 500 of you. And so So the 500 people that I do reach out to are my sample. And what those 500 people say to me about how they studied for their board exam, I can probably assume that the rest of you guys, the rest of the 5,000, would probably have used the same methods to study for their board exam. So sometimes it's not feasible for me to ask all the people in the population, to ask every single one of you how you studied for your board exam. But what I can do is I can find some people from the 5,000, and perhaps I found 500, and I could ask those 500 people how they studied for their board exam and then publish my study that way. Those 500 people are my sample, and this is who I will be asking those questions to. And then whatever they say, I will assume that the rest of the people, the 5,000 people that are in my population, would have also studied the same way. Now, to come up with how sampling method is done, there are many different methods of how sampling is done, which basically means there's many different different ways of how I can recruit people. So from the 5,000, how did I get that 500? Well, there's many different ways on how you can get the 500. One is random sampling. So I put everyone's name in a hat and I randomly choose 500 people from that hat. That's random sampling. Or I can have like 5,000 people, and it listed out in my computer system, and then I hit, there's a random generator, I hit generate, and I get 500 random people selected from that computer system, and I reach out to those 500 people that way. So random sampling is when I have no say who's been selected, and you have no say as to who's been selected for my study. That's random sampling. It's a random chance. This is the best type of sampling method that's out there. Very time consuming because there's a lot of people you have to, get people random sampling from. But it is excellent in terms of bias because there's very little bias, favorism with random sampling. Then we have stratified sampling. Stratified is where the word strata comes from groups. So you have perhaps boys and girls, and you randomly choose, some people from the boys' side, you randomly choose some people from the girls' side, and then you ask them how they studied for their board exam. So key thing here is you have groups, and if you have a bigger amount of girls, then you gather more people from this section and less people from this section because there's less amount of boys. So stratified sampling is when you have groups. Systematic sampling is when you choose an X number. So for example, let's say I have numbers 1 to 100 in in a hat, and I randomly choose a number, and let's say the number I get is 9. If I get 9, for example, then the 9th person from the list gets selected and participates in my study. So imagine all of you guys lining up, and the 9th person, or I could have all of your names down here, and the 9th person from the list gets selected into gets selected to participate in my study. And then I go further down the list, the next 9th person gets selected to participate in my study. The next 9th person gets selected. So you randomly choose a number, and that number is your number, and you're basically going through the list, and every 9th person is getting selected. Now I just randomly chose the number 9. It could be every 5th person, it could be every 2nd person, it could be every 100th person. Whatever number you randomly choose, that's the one that you're going to use, that number as you go down the list to get your sampling, to get your sample. We have cluster sampling, where you have groups of people. So you could have people that graduated in 2000, people that graduated in 2001, people that graduated in 2002, and people that graduated in 2003. And you randomly choose, 2 groups, and from a hat, let's say you chose 2000 and 2002, and then you ask those people how they studied for the board exam. So that's cluster sampling, where you have groups and you randomly choose groups. So these are all great types of sampling methods because they're all random, okay? I randomly chose the number 9. I randomly chose people from these group. And again, I put all of their names in a hat, and I randomly chose 3. I put all of their names in a hat, and I randomly chose 1. Same thing with cluster sampling. It's random. You randomly put all their groups into a hat, and then you randomly chose yellow and blue. There's multi-stage, stage being the key word here. You start with something big and go small. So these could be all provinces in Canada. So Ontario, BC, Alberta, Quebec, for example. And then you randomly choose one province. So Ontario and BC, let's say, got selected. And then from these provinces, you randomly choose people to come participate in your study. It happens in a big stage. So it goes from something big, like all the provinces in Canada, to something small, and then further down. So you kind of go from big to small in stages. And again, this is random sampling because you're randomly choosing from a hat as to which province gets selected. So these are all great sampling techniques, random sampling being best, then stratified sampling, and so on. Of course, it depends on your type of study because sometimes you can't do random sampling, so sometimes you'll have to go through other methods of sampling. But you can see here, there's many different ways we can recruit people to come participate in our study. These are not so good ways. So convenience sampling, if I just come and enter into a class and I find the closest people around me and I say, you, come to me unless I have a few questions to ask. That's convenience sampling because I just went in there. These people were readily accessible and I grabbed them and I told them to come forward and participate in my study. That's convenience sampling. It's not great because these people that are over here could have also, participated in my study, and it could have also provided valuable feedback, but I didn't take them into consideration. I just found the people closest to me and I said, you guys just come with me and I want to do a study on you. Not exactly easy because it was just convenient for me to find these people. Hence, it's called convenience sampling. Voluntary sampling is I come into a class and I'm like, who wants to participate in my study? And these people participate in my study. That's voluntary. These are people that have the time. These are people that are eager to share their information with me. That's voluntary sampling. Those people that have the time, those people who value what I'm trying to say, study, those are the people that will come forward. So again, it's not representative of everyone, right? It's not representative of everyone in the population. Population is everyone that's here. Sample are the people that I have chosen, or the people that were willing to come forward for the study. So these have bias. This one has bias, not exactly the greatest way. So again, convenience sampling is I come into the class, for example, or I come into an area and whoever is readily accessible, whoever is ready to come forward and participate in my study are these ones here. And this is an example of convenience sampling. All the other ones could have been great participants, but I neglected them and I just said, no, you guys are coming forward to participate in my study. Purposive sampling, or judgmental sampling, is also known as judgmental sampling, is when you pick and choose who you want to participate. So here, I just chose those people that were closest to me, and I got them to come forward. You go to a shopping mall, and whoever wants to participate in your study will come forward. But purposive sampling is when I choose my smartest students, for example, and I tell them, you know what, can you guys participate in my study, because you guys are going to make my study look good. You guys are going to help me with my study, because you guys will tell me, what you studied for the board exam and what was good. That's purposive sampling, where I just purposely choose who I want to come participate. And that's not good, because these people could have valuable, feedback that they could give me, but I just went and chose the ones that I wanted. And that's not a good way. Everyone should have the chance to come forward, or I should randomly select people so that anyone could have been chosen. That would be more fair. Snowball sampling. Snowball or referral sampling, also known as snowball or referral sampling, is when I can't find people to come participate in my study. So if I can't find people to come participate in my study and I only found 2 people, then I will get them to find more people. And I will get this person to find more people to come forward to my study. So it's by referral. It's like a snowball effect. I can't find people to come participate, so I'm going to get them to help me find others to come participate. So an example of that is, let's say I wanted to know how people came into Canada when they migrated here illegally from a country, for example. So I found 2 people that were able to come and migrate to Canada, and now I can't find more. So these people know of people that have migrated illegally to Canada. So they will help me find other people that I can then interview them and see how they came here to Canada. And again, or it could be someone, that's one example. Another example is it could be someone who has a rare disease, and I'm interviewing them about their rare disease, and I can't find other people that have that same rare disease. So they know of people that have that rare disease, so they're bringing those people forward. And then I can then interview those people that have that rare disease. The last one is quota sampling. Quota means fixed number. So quota sampling is, I'm the researcher and I'm like, I need 2 females and 1 male to come participate in my study. So the first 2 females that come forward, I use them to participate. These people participate in my study. And the first male that comes forward, I use them to participate in my study. And my quota is 2 females, 1 male. But what if this female wants to come and join? I would have to say no, because I've already met my quota. I just needed 2. This person probably wanted to come, would probably have been a great, person to give feedback, but I refused them because I only needed 2. And that's not really good, right? Because I should be listening to all their feedback, or the best way should be I should randomly choose, 2 of them from these 6. And I did. I just chose the first 2 people that came forward. And same thing with the male. What if, these people all wanted to come and participate in my study, but I refused them because I had already met my quota. I just needed 1 male, and that 1 male came forward, and the other ones I don't even take into consideration. Well, that's not fair. Okay, so these are different types of sampling methods. The best one is the random sampling, and then any of these would also be good because they also employ randomization, but this is your best type. This is like the gold standard, the best type of sampling methods.